We begin today's program in the Democratic Republic of Congo, where the latest Ebola outbreak continues to rage on, and the World Health Organization is concerned for the safety of humanitarians and the population in the affected region of North Kivu, a region also known to be a war zone. WHO Director General Dr Tedros Adhanom Ghebreyesus visited the region's Mangina area on Saturday and said that all those involved in the response must be able to move freely and safely to do the work necessary to control the epidemic. Without free and secure access, the WHO believes that it cannot properly fight the epidemic. Active conflict in the North Kivu region is a major obstacle to the work.
The humanitarian workers on the ground are very concerned about the situation. A new death confirmed among cases of Ebola virus disease has been recorded in the province, bringing the number of deaths among these cases to 11, the DRC Health Ministry said on Saturday. According to the ministry, 48 cases of hemorrhagic fever have been reported in the region. Present in Beni also the director of the Africa region of WHO, Matshidiso Moeti. She spoke about the advancement of care in the organization's treatment camp. Take a listen.
Here we are visiting a treatment center, which is actually at the epicenter of the epidemic. That's where there's been the largest number of cases. They are very much in the process of putting up a facility that's able to separate and triage the suspects, the probable cases, the confirmed cases, and those who are convalescent, those who are recovering and getting better, very much working with the local community here.
Regarding the Ebola vaccination campaign, the director indicated that all parties involved are working.
The speed with which the government responded to this new outbreak, unfortunately. The minister has been here 3 times already. They declared this immediately. They are setting up here the operation to do all aspects of a response, the contact tracing, following up on alerts, putting the system in place to coordinate the partners at several localities. I've been very encouraged that we've already managed to start the vaccination of healthcare workers because they're the ones most at risk. We've learned that the pattern of exposure of people is a bit different from what we saw in Equator. It's very much women and children who are engaged, and therefore there is need for the local team to make sure that the families are taken care of if the mothers are hospitalized or are suspects because of this.
Finally, Matshidiso Moeti was optimistic about the challenges faced by health workers and local communities.
It's a place where there are huge challenges as far as security is concerned, and therefore there is a need for us to work within the context of the colleagues in the UN and also to work with the local community to make sure that we have the access when there is need to have access. We know when it's safe to go into places to take action. I believe there are African health workers who are very much now experienced in this type of context, and we need to find them. We need to be able to deploy them in situations where they can apply the strategies that they've learned at home in these different countries.